Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. The first line drugs are in TB, that's tuberculosis. Let's look at some general properties. So the first one is the isoniazid. So in case of isoniazid, the mechanism is bactericidal. So it is bactericidal. So all the drugs we are discussing is going to be bactericidal except one drug. So what is the drug? It is going to be bacteriostatic. So bacteriostatic will be nothing but the ethanol, ethambutol. Ethambutol is a drug which is going to be bacteriostatic. Next, looking at the location of the mycobacteria, the isoniazid and the rifampicin. So these two drugs, what is the speciality? Here it is both intracellular and the extracellular location of the mycobacteria. Next, when you look at the pyrazinamide, so next is one is intracellular and one is extracellular. So intracellular will be the pyrazinamide, the extracellular is going to be the ethambutol. Now let's move on to the mechanism. So where is the metabolism taking place? In isoniazid, the metabolism, it takes place in the liver, and even in rifampicin is the same. Now when you look at the pyrazinamide, it happens in the liver again, whereas the ethambutol is an exception for many, like it is bacteriostatic compared to the others, it is extracellular only compared to others, and the metabolism is in the kidney, whereas the others it was in the liver. To learn and grow daily like this, please do subscribe.